So you
Yes.
talked about the minoxidil,
Uh-huh.
and there's some pills you can take and whatnot. I keep reading about this thing called PRP. Can you tell me a little bit about PRP, because it seems to be the hot procedure now for people that are losing their hair?
Yes, Ryan, I can tell you all about it.
Okay.
So platelet-rich plasma, or PRP, so platelet-rich plasma, PRP, is a growth factor injection, basically. It's an autologous serum, meaning that we take it from the patient themselves. We withdraw the blood, spin down, and separate out the platelets. The platelets are extracted and they're mixed with an ingredient that will activate them to release their growth factors. So platelets are really important. They're used in wound healing. So, if you cut yourself and you form a scab, the platelets are within that scab. You peel the scab off and the wound is all healed, and that's because the platelets are secreting growth factors into the wound. We use that property for hair loss. So as I mentioned earlier, you have these dermal papillar cells underneath your hair bulb that are important for producing normal hairs, normal nice thick hairs that cycle regularly. Those are reducing in people who have hair loss or have hair thinning. So the fewer of those cells you have, the thinner your hairs are. When you inject the platelet-rich plasma around those hair follicles, those growth factors will directly signal those cells to re-amplify and grow again, thus leading to thicker hairs that shed less. So that's how the platelet-rich plasma works. The device and the kit that we use and the serums that we use are combined with a fibrin-rich matrix that forms a gel underneath the scalp 10 minutes after I inject it. That serves to hold the platelets in place, and it allows it to release the growth factors over time for the next 3 days before it dissolves, and that gives it better efficacy. We also will then microneedle the scalp that time at the same time as the procedure. So the microneedling is basically done with a device. We'll use a derm roller, or we can use a skin pin that has these tiny little needles on it, and it aggravates the scalp, causes mild inflammation on the scalp or microtrauma that draws more growth factors to the area, and the platelets are more attracted to that microtrauma, and you get a better result with that. So we usually do 3 sessions of those at least, and we spread them out every 4 to 6 weeks, and then we wait about 6 months to see the results. So that's how platelet-rich plasma works. We're also doing exosome therapy now. Exosome therapy is similar in concept with platelet-rich plasma. It's basically growth factors that are packaged, and you just inject them directly in the scalp the same way that we would do with the platelet-rich plasma, and it works well as in addition to the platelet-rich plasma.